Okay, we see a few of you are just trickling in. I wanted to just give you a couple of minutes to kind of come in. I guess I still see a couple of numbers kind of shooting up, so we'll give it a couple more minutes and then we'll start the presentation. So thank you all so much for joining. Okay, so I don't want to take too much more of your time. I want to kind of jump into the presentation. Just note this presentation is recorded and you should be able to have access to it a couple of days after the presentation. And so if someone misses the first part, don't feel too bad. You can go back and rewatch it. So again, welcome. My name is Dr. Tiffany Bumpers. I'm the Director of Health Profession Advising here at Northwestern University. Congratulations, and I'm excited to talk to you a little bit about, what it means to be pre-health here at Northwestern, and hopefully we'll get to answer some of your questions that you have. I can already see some of you dropping questions in the chat, and I think that's great. So feel free to drop any of those questions, and we'll try to answer them as many of them as possible. Also note that we typically do a follow-up, and so we will be providing you with kind of other answers to the questions that we were not able to get to tonight. So I want to kind of note that this is totally unplanned, but I'm super excited that she's here. I have Dr. Felicia O'Rourke that is also kind of managing the chat. And I know you can see her screen just above. And so thank you so much, Felicia, for jumping in this evening to kind of answer some of those questions. Just a brief overview. You all may have received information about this pre-health week. And so we have a really great lineup, I think, of just really high-touch information that kind of goes a little bit in detail about the programming that we have and the value and the resources available within the health profession office and ways that you can kind of access them. Know a little bit about student life, about some of those academic programs and how to be as successful as possible while you're a student here at NU, as well as how we support you in obtaining extracurricular activities outside of the campus as well as on campus. So this is the HPA team. I feel really fortunate, and I think you guys will really appreciate this as well. We get to work with, I get to work with such amazing people throughout the year who really are passionate about the work that we do. And so again, I mentioned Dr. O'Rourke, but we also have Phil LeBlanc, Nancy Tapco, Miss Kayla James, Brian Keeler, as well as we have a grad intern, Jane. But unfortunately, when you guys enroll, Jane will not be within our office, but we'll have another intern to kind of help support you throughout your journey. So overview, right? In HPA, we aim to advise, engage, connect, and prepare all undergraduate students and undergraduate alums to pursue careers in health, and that's across the spectrum. So advising and support. The number one and the greatest priority within our office is one-on-one advising. And so most students come in and are assigned their advisor their first year, but we will support students throughout anytime that they reach out and let us know that they want a pre-health advisor. And now how this typically works is you would indicate that you have an interest in pursuing some form of one of the many health professions, and you will receive an invitation to complete our intake form. We typically do not start meeting with first-year students until October. So usually around October 1, you will receive communication from our office that lets you know who your assigned advisor is. And then you can go into what we call is connecting you, which is an advising system to set your appointments as often as you would like to meet with your advisor to discuss kind of any and everything, which kind of brings to the next bullet point, right? So advising conversations, what do we talk about? We talk about pretty much everything. Their prerequisite course planning, exploration of health professions. So sometimes we come in and we know exactly what we want to do, and other times we don't. And I think that's totally normal. And sometimes we know exactly what we want to do until we change our mind. And so we're here with you throughout that process. And another note for our advising structure is not only are you assigned your advisor your first year, if that's when you kind of make your initial connection with our office, but we're with you throughout your 4 years at NU, as well as when you're an alum. Our work with you does not end at graduation. Really, it's a transition. The only time we transition really is when you are going into a health profession. So not only, do we work with you as an undergraduate student, but we really, really try to help support you as you are applying even 2, 3, 5 years down the line. Whenever you decide to apply to a health profession college, you can always reach back out to your HPA office, and we're going to pick up right where we left off. So I think that's a really unique feature of our office. Other activities or support and things that we typically talk about. We talk about application-related assistance. And again, I mentioned earlier that we do help and serve as a resource for you when you're looking for co-curricular experiences like shadowing or maybe clinical volunteering research. We tend to try to help students connect to those opportunities as well. So programmatic initiatives. Each year we start our year off with a meet and greet, which allows for all of our partners across campus, everyone in our office, as well as the health professions programs that are on campus to come to our Evanston location campus and really connect with and meet with all of you. So this is a great opportunity for you to get to know some of your fellow classmates and upper class persons, as well as connect with others who are kind of pursuing so many different fields of healthcare. And you'll be face to face with people in the College of Medicine, Global Health Studies, other individuals, physical therapy, and et cetera. So we have quite a few health profession programs that is a part of Northwestern. And so this is an opportunity to directly connect with individuals that you would definitely want to meet when it's time for you to either pursue that as your health profession, but also if you're looking for co-curricular experiences and you really are trying to find a connection where you'll be able to learn what that health profession is really about, these are some of the people that you definitely want to know, right? So we want to open up the year every year with a bang, and we do that at our meet and greet. Other areas, we have health profession colleges from across the country come to visit, and we do visits both in person and virtual. It's usually up to the program that is presenting. We also offer a comprehensive medical school application support program. So when you are applying to medical school, there are lots of components. There's also some of those things are very much time sensitive. And so you have your advisor, but also the HPA team to support you as you are crafting and developing your application so that you put forth your best effort when you're submitting that application. We want your first try to be your absolute best. And so we have devised several different workshops and other informationals in order to prepare you for that process. We offer the Promoting Diversity in Health Professions series, which is a great series we have quarterly. And it says diversity because it is diverse in nature. Our last one really kind of focused on people who come from or who are interested in different health professions. So they bring a unique scope and perspective. And we really think that these valuable experiences that they've had as an NU student and some as an alum are really, really helpful in helping you understand like what's your next step or what might be possible for you. So Northwestern Undergraduate Clinical Apprentice Program, we call it NUCAP, is really a clinical shadowing program that we partner with Northwestern Medicine on. And so that's a wonderful program. It does kind of a limited number of seats. And so there is a small application process, but we try to make sure that students, while you're here, you have an opportunity to really get clinical shadowing in, especially if you're pursuing the role of a physician. Then we have connections programs. So these are programs that really connect students to other students who are currently in the health profession. So the Feinberg Connections program is with students that are current medical students, right? And physician assistant students who are currently physician assistant students. We're connecting undergraduate students with them, as well as the Doctor of Physical Therapy. These are 3 programs that we're really looking to expand. So as students' interest around various health professions kind of continue to explode, one I can think of is global health, right? Then we'll continue to build on these programs. But we really try to tailor what we do to serve your needs and the needs that our students are telling us. We have our weekly events and opportunities email, which is really a newsletter. This is an exceptional resource. This is where no matter what you're looking for in terms of co-curricular experiences or even job opportunities, it comes through on a weekly basis, and we maintain a database online that you have full access to, where you can learn and see what's out there so that you can apply for or note that you're interested in some of these unique opportunities. And so we highly recommend that, as well as anytime we're having some type of events or programs, it's usually posted in that weekly newsletter. Lastly, but really, the last kind of point I want to note is the pre-health quarterly student leadership meetings. So there are so many student organizations on campus, which I think is a great thing about NU. And so these student organizations that have a focus on health, regardless of whatever the discipline is, the leadership from those organizations are invited to our office on a quarterly basis to just discuss what they have going on. And we tend to support any ways that they can collaborate with each other to make sure that the work that they're doing and their leadership and the growth that they're having, that we're invested in that by supporting and promoting their programming. All right, so the next one is really on student profile. Sorry, it's like a blank. There we go. Student profile, right? So each year, first year students coming in, about 50% of them identify as pre-health. So that's quite a few students, and we're excited about that. So you should feel good about the fact that you are part of a lot of students that also are interested in pursuing health careers. Right now, we serve over 2,500 undergraduate students as well as undergraduate alums, and those are people who are actively advising currently. Roughly 15% of our students identify as first-gen students, and there are 97 international students within that cohort of students, representing 38 different countries, right? Our office has, and this fluctuates every year, sometimes higher, sometimes usually around this number though, about 1,141 unique student advising sessions. And what that means is 1,141 students have had at least one advising appointment. But of course, we have way more than that because students often come multiple times throughout the academic year. All right, so you might want to know well, what are students majoring in? Like, what should I major in if I'm pre-health, or particularly if you're interested in pre-med, right? I really want to say that if you are interested in medicine, there's not a particular major that you have to have, but our number one, so to speak, major would be biology, right? Behind biology would be neuroscience. And the largest feeder college for health profession students on campus, 80% of those come from Weinberg. All right, so this is just a little bit of information, but I think what's really great about this, and it really goes to what I said just earlier, which is you don't have to have a particular major. Our pre-health population represents 70 unique majors across the undergraduate schools, and I think that's really great. All right. So more than 80% of our students take a gap or bridge year. And I want to say that because And I want to talk a little bit about what a gap or bridge year is first, and then we'll talk about why more than 80% of our students take a gap or a bridge year. A gap or a bridge year is usually the year after post-graduation, so a year or two after graduation is when most of our students at NU apply to medical school or some other health profession. Now, this is a time that is not just a gap where students are not doing anything, but rather they're building their co-curricular experiences. They may be taking some additional courses to make themselves more competitive. But overall, the rigor of the courses here at NU can be very challenging. It can make it very challenging to have some of those co-curricular experiences that some of these health professions programs are looking for from their students. And so that gap or bridge year really gives you an opportunity to make sure that as you're going into the application process, that you know kind of what the field entails, what the day-to-day work is, but also you can be able to talk about it more fluidly, both in a written capacity as well as during your interviews, right? And so it really helps to build your knowledge based and steeped in your own experiences as you pursue admissions into whatever respective program that you might be interested in. On average, we support over 300 students with their applications, right? And the application process, these are month-long process. Really, if you are pursuing, the role of physician, that process is about 15 months. And so as you might imagine, there are so many pieces, so many steps and timelines associated with them that it does kind of take a village, so to speak, to help move you through that process. And we're really fortunate to be a part of that group of people to lead those efforts. All right. So again, around 85% of our students that identify as pre-health do pursue the physician kind of pathway, with the other 15% across the spectrum of other health professions, so other allied health professions. In the last few years, there's been quite a jump in public health, which is to be expected. And a lot of times the students might pursue public health even after they've kind of obtained their MD or some of these other health profession programs. They may have already obtained their degree in those areas and still revert back to public health, because part of the role of public health, right, it really is about health of large scale communities. And oftentimes you are drawn to the work of a physician because you really want to help large populations of people. And so it's a beautiful pair. So that's one of the things that we tend to see jump up quite a bit. And I would also wager that perhaps this global pandemic that we all endured might have something to do with that as well. Okay, so by the numbers, I'm going to give you just a second to digest this screen, because I know that many of you may be interested in these numbers. Now, I'll be honest with you, I really don't like to share my numbers, but because you're special, I'm going to share them with you this evening. That is 78% of our students that entered medical school for 2023. 78% of those students, received an acceptance rate, right? And in comparison to the 46% for the national acceptance rate. This number does fluctuate, so it's not the same every year. I think this is a great testament to how hard our students work and just how much support that you receive, not just from our office, but across campus, as well as from your families and your friends. You work extremely hard, and I think that that number is a reflection of that more than anything else, right? But we're really proud of those numbers. You can see some of the other numbers of the other health professions kind of listed below. So I'll give you a couple of seconds to kind of digest that, and happy to answer any questions you might have in the chat that you want to throw out there. I'm sure Felicia is busy kind of trying to respond to all of those questions. Okay. So, we stated this earlier, that you don't have to have a particular major, but primarily a set of recommended courses and experiences based upon health professions programs, requirements, and recommendations, for a successful application. And so we are very versed in helping to support you in this. And that is just simply to state, because you're going to be majoring in so many different disciplines, and many medical schools, if you're looking at pursuing medicine, they have varying requirements. Now, there are some general requirements, but some may be very specific. We have a set of resources and tools for you to figure out, like, which one of these medical schools, of the ones that I may be interested in, are looking to apply to, making sure that you have all of the prerequisite courses associated with it, and all the co-curricular experiences that they are looking for in order to make a well-rounded application. And so that's really what this slide is speaking to. All right, so majors and paths, health professions program, select applicants with a wide variety of skills, interests, and majors. I feel like I'm kind of a broken record on this one. And this is just simply kind of restating. It doesn't matter what your major is. I know that there's a heavy tendency for students to try and go towards what they think that these schools are looking for. But what we want to encourage you to do is we want you to pursue something that you really like and that you love. And then we'll help you figure out how do you fit in those prerequisite courses. And the reason why going with something you like and love is really to your advantage, is because those are the things that make you truly unique. And the last thing you want to do is to kind of mute your own kind of high value, what makes you unique, in order to try to fit in with others, because then it makes it very difficult for you to really stand out. And if a school is getting over 10,000 applications, one thing you want to do is stand out. So admissions facts, all right? Grades, coursework, kind of entrance exams, clinical experiences, research, co-curricular experience, leadership, community service, application. These are all things that we tend to support you on and help you kind of figure out what works for you within your schedule, even if you're an alum. So once you graduate, like I said earlier, about over 80% of our students do take a gap or bridge year. These are all areas outside of just your academics that these medical schools and other health professions are looking at. And why do they look at these things? Well, grades and coursework, right? Grades and coursework are kind of the easiest parts to assess because they're numbers. You can use a computer to kind of spit it out. But some of the, and that would be the same thing with like those, the MCAT or the DAT or the GRE. Those are all things that are really things that are easy to calculate, but it's very difficult to see if you really understand the role of a physician, or if you really are interested in pursuing, let's say, dentistry, and you know what your day-to-day will be like. It's difficult to ascertain that by only just writing, because you can write really well, but being in that space is a very different experience. And so some of those, what some may refer to as soft skills, you're going to have some experiences that allow for you to really build kind of your knowledge base so that you can fluidly communicate why this profession as opposed to some other, and to show that you have kind of done your own homework and due diligence and that you're ready and prepared for the next step. And so you do that by, engaging in community service. All of the work across health profession is geared towards serving others. And so how have you served others, right? All of those co-curricular or extracurricular activities, your leadership skills, those things are very hard to kind of gauge just on surface. And so your experiences with those will really help in a long way when it comes to writing your application, as well as when you're actually kind of interviewing. All right, so this is the last slide. I know that you've been dropping questions, but I don't know if we have time, Felicia, and maybe you can help me. Do we have time for a question? Do you want to kind of note a few questions that you saw in the chat that came up?
Yeah, thank you. I was just working on one. But yeah, so I answered most of the questions in the chat. I think the only thing that I would want to just re-emphasize is I did drop undergraduate admissions contact information in there. There's a bunch of questions that kind of came through about what should I do now to craft a strong application. It's such a great question, so you should be asking those things. Our office works with students after they start here at Northwestern, so we are not the best people to ask that question to. We will help you a ton when you get here, but make sure you direct those questions on what should I be doing now to our admissions folks. But other questions have definitely come through that I think have made a lot of sense. One just popped up. Since we have time, I think I'll just go ahead and answer it, Tiffany, if that's okay. That because this program is so competitive in the end, what makes a student stand out most? Admissions are most likely the same. How do you stand out? So I can answer that from the lens of, how do I stand out from admissions into like a medical school or a health profession school or whatever you're looking to for that next step. And this even comes from the mouths of people who oversee admissions committees for medical schools, and that the way to stand out, and it sounds a lot easier said than done, but it's truly to have a really good understanding of who you are and who your values are. The best applications and the applications that stand out the most are the ones that are truly able to get a vulnerable look at who this person is, and they are able to convey their story, convey who they are, convey their motivations and their values through that writing of the application and through an interview, which we help with all of that because we know that that's a very challenging thing to do. But that's why you'll kind of hear us as a broken record, just be like, go to the things you like, go to the things you value, go to those things that really resonate with you. Reflect, reflect, reflect. We tell all of our students constantly, keep a journal, reflect on your experiences, because when you can pull out that mature level of understanding and reflection of yourself, gosh, those are when those applications stand out. So thanks for asking that question and allowing me to say that, because that would have been very hard to type. So I appreciate that. But otherwise, I'm just finishing up one other question, and we don't have any other questions rolling right now, Tiffany. So I think we are all set. So I'm just going to finish this one and post it through and see if any other come in the next minute. But then otherwise, we will.
Okay. Thank you so much, Felicia, for answering that question. I 100% agree. I also want to thank all of you for taking the time this evening. It is a Monday, and it feels like the most Monday ever to me today. And so I hope that you found this information really enjoyable, but also very informative. And I think we're good. So thank you so much. Please jump in on some of those other sessions. We have one that has a panel of students. I'm going to jump in on that one as well, because I really like to hear what our students have to say. And I think that you'll find it very valuable as well. But we have a week lineup. This is day one, and we look forward to seeing you tomorrow. Have a good evening.